Signs of aging, eye bags and treatments to get rid of them? I'm a 30-year-old woman and my eye bags are really getting to me. It is the worst in the morning. I'm wondering what options are available to make my eyes look youthful. I am very new to this and have no idea where to start. Does the whole eye socket need to be worked on or just the under eye? How much do these procedures cost? Many thanks in advance.
Thank you for your question. You're 30 years old and the puffiness under your eyes is bothering you and you want to learn more about your options. So you've submitted a single photo and with your eyes closed, the lighting isn't fantastic, but certainly I can get an impression of the puffiness under your eyes. So let's start by first defining what the puffiness is. The puffiness under the eyes is called lower eyelid fat prolapse. Lower eyelid fat prolapse means the fat that's normally around your eyes pushes forward and creates this bulge. Now, it has been studied in MRI studies that it appears that not only does it push forward, but it actually is an increase in volume of the fat around the eyes. In my experience, I find this to be basically a hereditary issue. So we have had patients who have had this corrected as young as 14 years old. And many times when people come to us, they tell us that they've had these puffiness under their eyes since they were teenagers. What basically happens is that over time you can have good days and then not so good days, and eventually there's a point where the puffiness is always present, and almost uniformly every patient will tell us that they are tired of being asked if they are tired. And so they start usually by first doing a little bit of self-treatment. And so they'll often go to department stores and find topical creams. They'll even try hemorrhoid creams and, looking at various resources, and the internet has no shortage of topicals that claim to get rid of puffy bags under the eyes, and unfortunately none of them really work. When you talk about something that's an anatomic volume of fat, then we need to address the fat. There are different ways of addressing this, but basically you are talking about some type of a surgical procedure. And the procedure that we typically do on a younger person, and this is of course in the absence of a physical exam, but I'm pretty confident that with your skin and the appearance on the photo you submitted, that you would be a good candidate for a procedure called transconjunctival blepharoplasty. Now that's a lot to say, but it basically means that what we do is address the fat pockets from behind the eyelid. Now that seems very strange, but it's actually a very, very elegant way to address these fat pockets because there's no external incision or scar. And also, by doing it this way, and all this is a more advanced technique, we're able to spare a lot of the important anatomy. I can't tell you, unfortunately, how many people come to our practice who have had eyelid surgery done by, quote, big names, and their lower eyelids are just pulled down or they're rounded out, and there are many factors that cause this. So my approach with you would be to address the fat pockets, either a combination of resection, repositioning, whatever is necessary based on your unique anatomy. And basically once that's done, it is essentially done for a long time. Those fat pockets do not return. There may be other changes that happen as you get older, but certainly I think that would probably be the best way to go. At this point, it is probably ideal for you to now start doing some meetings with doctors. But before doing those meetings, get to learn about who the doctor is, what their specialization is. There are a lot of people who do eyelid surgery. In the annual ranking of the popularity of different procedures, eyelid surgery ranks typically as like the #1 facial cosmetic procedure. And so a lot of doctors do it as an oculofacial plastic surgeon. this area is an area that not only do I see a lot of patients who require this, but I see a lot of people who need revisional surgery. So it's just important that you find a doctor who is technically qualified, technically skilled, and you have a sense of their style. And in addition, I would add that it is important to consider the type of anesthesia you would go under. We do this procedure under local anesthesia with light IV sedation, and it is a beautiful, elegant procedure in that regard. Our patients tend to recover very quickly. Very often, when we see them in a week, we can barely see any bruising at all. And so it's a very nice procedure with a lot of long-term benefit. Once again, meet with qualified specialists, get to know them, get to know if you resonate with this personal style and if there's good chemistry and communication, and then move forward. So I hope that was helpful, and thank you for your question.